All right, I think we'll go ahead and get started. Hello, I'm Hannah Wolfson. I'm the editor of HomeCare. Welcome to and thank you for joining us for Elevating the Patient Experience within Home Health and Hospice, which is presented by CareXM and HomeCare Media. I'm going to take a minute here to introduce our speakers, but first let me just say, for those of us who have joined us, those of you who have joined HomeCare for webinars before, this may look a little bit different for you. We're really excited to share our new webinar platform. You'll still have lots of opportunities to ask questions. You should have a chat box on your screen or a question box on your screen where you can enter your questions at any time, and we'll get to those at the end for our interactive Q&A. So it is my pleasure at this time to introduce our expert speakers. Bridger, you want to jump forward so we can meet you guys? This is Bridger Meacham. He's Vice President of Marketing for CareXM. Bridger is an experienced brand and marketing director with a demonstrated history of working in the IT and services industry, as well as in software as a service and consumer goods. Before joining CareXM in 2020, he was Chief Marketing Officer for Red Sky Technologies, an SaaS startup focused on building connected technology. And then we've got Lori Nelson here. From a very young age, Lori dreamed of becoming a pediatrician. As time went on, her dreams led her instead to a career in nursing. She received her BSN from Wichita State University in 2001. Her first job out of nursing school was in a hospital intensive care unit. She then made a dramatic career shift to hospice, where she found her love of supporting and empowering those taking their final journey out of this life. Today, Lori is the clinical advisor at CareXM, where she has worked for 12 years, helping providers integrate new technologies into their patient care processes, which improve both the patient and caregiver experience. Today's webinar will discuss best practices for improving your patient experience that will reflect in your CAHPS scores, reviews, and referrals. We will also discuss strategies for increasing your census without risking a lesser patient experience, so you can grow fast with flexible solutions that scale your business. And I know Bridger's going to talk a little bit more about this introduction here and introduce us a little bit to CareXM as well. So I'm just going to go ahead and say at this time, it's our pleasure to jump right in. Please stay tuned again afterward for the interactive Q&A and send us your questions at any time. So I'm going to turn it over to Bridger.
Thank you, Hannah. So to kick things off, and thank you to everyone that's joined us today, everyone that's signed up, and anyone that watches this in the future. If you're like me, you sign up and watch these when it works for you. Please jump in with any questions. To set the table and set some expectations a little bit, the better half, my colleague, Lori Nelson, will be speaking after me. So you'll have to suffer through my 15, 20 minutes here. And very excited to have her share some of her background from a clinician standpoint. And what we're going to focus on today, and I'm going to just be very raw, very real, is the true feeling of what we experience in healthcare, especially in the home health and hospice setting. Our purpose, our drive, I've been lucky enough to grow some businesses not in healthcare that didn't have much of a purpose. I wake up every morning a lot earlier than I used to, excited to solve for a problem, to solve for what we're seeing today, which is clinicians leaving the healthcare space, while we're also dealing with an aging population that's almost doubled in the last 10 years, and 90% of them want to age in place. That's what we work for. That's what we're solving for. And whether you partner with us or not, I don't care. What I care about is solving for that problem. And so your questions, your insights, that's what drives innovation, is us partnering together and solving for the problem. So that's really the gist of what we're going to discuss today, what we'll be tackling today, tomorrow, yesterday, and a month from now, a year from now. Again, I said I was going to be raw. My passion, I have a wonderful great aunt that passed away about 2 years ago before I started working at CareXM. And she was in a hospice setting. I had no idea that she was declining. No clue. No one in our family did. She was my great aunt, my wonderful grandmother's youngest sister, and she was all by herself in South Dakota. She was a widow, and I had no idea she was declining. And I don't understand why today I can hop on Facebook and see someone from 20 years ago in high school that I knew, barely spoke to, but I can see that what they had for dinner last night. But I did not know that my sweet great aunt Patsy was dying. And I had it on my list to call her, and I did not. And I have to live with that. Well, my passion, my energy is to solve for that, and really focus on the clinician experience and how we can solve for the people that are leaving this space and get them back in to where they do have work-life balance, which is a strong notion, but that's what we're trying to deliver. The other story I will share with you is our founder, Kevin Childs. He has a heart this big. I don't know how he fits it into his broad shoulders, but it's this big. And he he's very adventurous. He comes from the call center space and was lucky enough to meet Laurie Nelson along with her other two amigos. We call them the three amigos. They're our RNs from the home health and hospice setting. Wonderful people. And you're lucky to meet Laurie today on this call. However, so he was in a hospice setting. He had recently was hit by a car while he was biking a truck, and also was diagnosed with cancer. And while he was being treated and checked with his vitals and going through that experience, which is the height of anything that we'll feel, especially ourselves, but especially our loved ones, a wonderful nurse was taking care of him. And she also was on call. She was on call and was having to answer her phone while also treating Kevin. Today, on this webinar, on this presentation, if I took a call while I'm trying to present to you, but I took a call or answered a text message, how would you feel? I would feel pretty bad. And that's just on a webinar. That's not dealing with your own health crisis. So that's what we're trying to solve for today. That's what we're going to talk about a bit today. I'll go forward. I'm not going to introduce the company. We're a nice company. We love to work with people. We have over 4,000 partners throughout the U.S., and we very much specialize in the home health and hospice setting. We have monitoring technologies. We have triage 24/7, and Laurie can tell you a little bit more about that. But basically, what we care about is this mission. That's what we're focused on. So, balancing the patient and clinician experience. This is something that we focus actually on the clinician. That's what we focus on. We have over 100 RNs throughout the US, one of them on this call, and Laurie Nelson. And what we do is focus on improving that experience for the clinician, because by empowering clinicians with the right tools, right technology, and support 24/7, 365, we then can elevate the care experience for the patient. This image, I'm sure many of you can identify with this. The nurse that was taking care of Kevin can identify with this. She was putting her whole heart and energy into taking care of him while also being on call and trying to take care of the patient that was calling her. We need to fix this emotion, this work-life balance, this experience for clinicians. We have to be advocates for our clinicians, and we have to solve at the root cause of why clinicians are leaving, why nurses are leaving the healthcare setting. And that's our focus. We talk about the quadruple aim, which is patient experience, clinician experience, lower costs, and better patient outcomes. But at the heart of that is the clinician. They're the ones that are tied to the brand, tied to your brand. They're the ones working with the patient, actually one-on-one. talking with the loved ones, the caregivers of that patient. That's what we're focused on. So, patient experience. I'm sure anyone on this call has ordered something from Amazon or something online. You might spend 5-10 minutes reviewing a toothbrush and the customer reviews and how it's rated and how it works. And that's a toothbrush, a $3 toothbrush. I've done it myself. We're definitely reviewing where we're going to have our care. And that's different. It's beyond CAHPS. We get referrals, that's great. But the first thing we're going to do is research and check. And the patient experience is directly tied to, just like in the service industry, if you have a problem, let's say with your DirecTV, your satellite, whatever it may be, and you call in, attentiveness and care is what you're looking for. And you associate your experience talking to that customer service provider, that person on the phone, to the brand. I tie it directly to DirecTV. So the patient experience is very similar to the customer experience. And we have a dichotomy here. We have an interest of, we have less clinicians, but we have more patients, more customers wanting our services. We need to be attentive. We need to be agile and flexible. We talk about better outcomes, better patient outcomes. Well, the outcome is the experience, especially in hospice. It's the experience of end of life. Being attentive, being there, being focused, not being on call like that nurse was, and being able to focus on our patients. That's what we need. The perception of care is just as important as the outcome. The outcome is the experience. And we have more people, more patients wanting that experience. Over 90% of adults 50 plus want to age in place. That was 75% just in 2018. Now it's 90%. It grew that fast in just 2-3 years. 73% increase in 65 plus, something that we're all trying to deal with. And don't penalize your patients, your current patients, for your growth. Arm them with tools, arm your clinicians with tools, because we're all dealing with this organic growth, this organic demand. And we need to be able to serve that demand while also not hurting the current patients that we're serving. Oh, my graphic was a little slow. So right now, this stat, we have a 1.2 million gap over the next 8 years by 2030 of RNs that we need that we do not have. This again goes to the Great Resignation. It goes to what we're experiencing, all of us, including ourselves. With our RNs, we have 100 of them throughout the US. We're recruiting them for backup, for primary 24/7 support for our partners. We need to solve for the root problem, though, of why nurses are leaving this field, this space. And the reason, and Laurie can speak to this a little bit more eloquently, of course, than I can. I'm not a nurse. I'm a okay marketer. Nurses do not get a break. This nurse treating Kevin was on call while also trying to serve her patient, trying to serve Kevin, trying to serve the person calling her on the phone. She also, and he also, any nurse in the field needs to take care of themselves. They need to take care of their own family. They have this calling, this purpose, and we all love and appreciate that. But they also need to be taking care of themselves. So clocking out, being able to have status management and say, I'm off, is needed. You're also dealing with emotions far-reaching of losing people, losing patients, all the while trying to treat these patients multiple at a time. This is what we're going to fix through listening and empowering your staff. What we do every day was built off and continues to be built on by our clinicians. We can talk about technology and user interface and all the fancy mumbo jumbo. At the end of the day, we need technology that serves the user, which is the clinician. I'm going to make a weird segue here because this slide was misplaced. That's on me. Listening to your staff is important, very important. Also listening to your customer, your patients, because now we all have a microphone right here that I can right now put a Google review, Yelp review on immediately if I want to. As soon as we have a poor experience, we have a microphone that we can then share. And there's nothing more impactful than word of mouth in advertising. And the great referrals that you get from large hospitals and health systems are being validated right now by that patient or their loved ones by just some quick research, some quick Google reviews and Yelp reviews. In light of that, just like we were talking about with direct TV, our expectations have shifted a little bit in the time that we get our products and the time that we spend on hold, whether it's for our healthcare or just customer service in general, but especially for healthcare. My wife, when she had a double C-section, was running out of her scripts for her pain management. And I was nervous as all get out because it was Friday evening that I wasn't going to be able to solve for that. And I had to be on hold for 20 minutes and then wait for a call back for an hour. Minutes matter, and minutes feel like hours, feel like days when you're having a healthcare crisis. When you're having that crisis and dealing with that and trying to pass the time, you're going to hop on social media and share your experience to the world. You can share it immediately. All of us have this cute little microphone that we carry in our pockets. We can do it anytime, anywhere, and share our experience with anyone. That matters. It's beyond CAHPS. I'm not going to invalidate CAHPS by any stretch. It's the holy grail. But just as important is your reviews, the reviews that you're seeing online, the reviews that people are sharing in person or through social media, which has shifted how we make decisions every day. The toothbrush example. I'm going to go research a toothbrush. 10 years ago, I probably just would have went to Walgreens and found the one that was a cool color. Now I can look and see everyone's review, 500 of them if I want to, and research before I make a decision. And it's quick, it's easy. 95% of patients research you before they make a decision. They're looking you up online. 70% of patients, 60 plus, rely on positive reviews. Our aging demographic, guess what? With COVID, we're all really comfortable hopping on Zoom now or hopping on FaceTime. We're also very comfortable looking you up online because it's easy, which is what this illustrates. We're very educated now. We can make very good buying decisions based on other people's experience. On the flip side, in wet blanket, is the impact of a negative review. It's far-reaching than ever before. 40% of patients will not select a provider if you have poor reviews. 40%. It's a big chunk. So competitively, as we all are trying to solve this problem, but also are trying to grow our businesses,
Hey there, let me jump in. It looks like Bridger might have had a little bit of a connectivity issue.
on the flip side and positive.
Oh,
Go ahead.
You broke up for
wow.
just a second. You disappeared on us for just about 10 seconds, but you're fine. You can keep going.
Oh, thank you, Hannah. I apologize.
No, not you. I'm sure it was your internet. So.
Yep. Well, I apologize on behalf of my internet. I'll flip back to this. So the negative review, I don't know what was caught or lost, but we all know the importance of a negative review and what impact that can have. So focusing in on that and making sure that you're listening and taking actionable insights off a negative review or any feedback that you're getting from your patients, your customers, is vital. On the flip side, the power of advocacy. We all love referrals. We want more and more and more of those. Well, when you have not only the referral, but advocates openly talking about how great the experience was with your company, with whoever their care provider was, the impact's tenfold. There's no greater tool that you can have to grow your census, grow your business than advocacy. So with that, hopefully I didn't go too fast through there and went through all my notes here. I'm going to toss it over to Laurie. She's going to talk through some of the best practices in scaling your census. And what that looks like. We'll share with you a case study with Bristol Hospice, where we were able to reduce unscheduled interactions by 50% while growing census 5x. Pretty cool story there, and something I look forward to her sharing. And please ask any questions that you may have. No question will go ignored, even if we have to answer it offline. But with that, my much better colleague, Laurie Nelson, will take it from here.
Thanks, Bridger. Yeah, when we think of growing pains in business, I think a goal that all of us have is to not have our customers feel our growing pains. So hopefully as we speak today, you can think of some different ways that maybe doing workflows, some of your practices can change and still scale and meet your business needs. So Bridger, if you want to go to the next slide, that'd be great. So one thing that we always talk about, because not everybody thinks about, is really how do we align resources for all these unscheduled patient interactions. So when we think of unscheduled patient interactions, we're really referring to those phone calls that come in that just alter our plan for the day. So one of the great things that we can really focus on is how can I change the way I've always done business and align resources effectively. In hospice and home health, we tend to staff for the worst case scenario. So if we look at the orange line, so the orange line will represent our staffing. The gray line is going to represent our call volume. And we tend to always staff for the worst, because when you're the one that the worst happens to, you wish you had an army with you, right? So we always tend to staff for the worst, but we can never predict those unscheduled interactions. So that call volume, that's the gray line, really low, but man, we're ready. We're ready for when it spikes, because we don't want somebody to get missed and their care to get overlooked. So how do we really align resources for that? So this is a better way for us to really figure out how we can align resources to those unscheduled patient interactions. Now, it's not as easy as flipping to the next slide like we just made it look. It's really taking the information and visibility that you have into those unscheduled interactions and finding a way to make them better. So the ideal way to do this is data. So how do we use our analytics? How do we use information, our business information, to make better business decisions? So if you think back to that first orange line and the gray line, we were scheduling for the worst. So when we think of a call center metrics, we don't always compare ourselves in home health or hospice to a call center, but every interaction that we have with a patient starts with a phone call. So we have to shift our mindset a little bit, right? To think, okay, call volume, call center. So we're always looking to make sure no call goes unanswered, it never gets missed, they don't wait very long. In order to do that, we always feel like our solution is people. But we don't always think about cost. We don't always think about time. It's people. So most of you in this room fall in the category where that big red arrow is, where we're staffing 1 to 9 to maybe 10 people, and we're getting a 29% productivity rate. So when you put that number to it, that's 70% of the time that your staff is not working. That's a little scary number. Most of us would get fired if that was our productivity, right? If that was our annual review and you're like, hey, you're a 29% worker, we'd be like, okay, there's the door. I'm on my way out. But that's how we have come to really support our unscheduled patient interactions in this industry, because we just aren't big enough to do anything different, and we've never thought a different way. So when we think about time and money, so I'm at a 29% productivity rate. That's costing me in the bottom right-hand corner almost $48 for every phone call that comes in for a patient. Now, if you think of your dollars per day that you get for your patients, that's a huge chunk of dollars for that one phone call that came in, because I'm not aligning my resources with those unscheduled interactions, or I'm not finding ways to decrease those unscheduled interactions. So now let's talk about analytics. So let's go to the next slide, Bridger. So you can't prevent those phone calls unless you know what those phone calls are about. So unless you have a clear, visible, organized, something that doesn't take you forever to count up and calculate a business analytics solution, you're not going to know what's happening after hours. You're not going to know the reason why patients are calling. You're not going to know why those unscheduled interactions are coming. You probably have a good idea. I may be able to say, hey, I know that Mrs. Jones is always going to call about this, that, and the other. They always call on Thursday for their supply request. Well, if you already know that, what are you doing to change that behavior to prevent that unscheduled interaction? So using business intelligence allows us to really take information, create visibility that allows us to change the way we do business. So in our analyzation of our unscheduled interactions is to really not just look at the information, but find out the why behind it. So finding the reason why people are calling and diving deep so that you can then make a change. So I'm going to give you a couple of examples of how this can have impact. So we have one of our clients who was having a huge number or percentage of their calls coming in after hours about medications. They could see that medications were coming in, but they didn't know why medications were coming in at a higher rate than our industry average that we would compare them to. So they took the data that they had, they dove a little deeper, and they recognized that if we proactively reach out to our patients, say Tuesday morning check-in call or Thursday morning check-in call, we are decreasing the number of after hours unscheduled interaction requests for medication refills. So not only does that decrease the number of calls coming in, your staff don't have to take as many calls. I'm not getting after hour delivery fees for those urgent medication refills that have to come, immediately. You can't let the patient go through the weekend. So they took the data, created an action, analyzed it, created an action plan, and saw a huge impact on not only their patient experience, because who wants to call? Bridger shared his experience of, I was running out of medication. Can you imagine what his experience would have been like if Friday morning somebody given him a call? Hey, how are your meds for the weekend? He would have never stressed. He'd be like, you want to know what? You're right. I'm not going to make it through today. And that patient experience is a completely different one than when he had to call after hours. So there's one example of analyzing some of that intelligence. The next way that we like to help you align your resources and help you really decrease those unscheduled interactions is actually having a better caller patient experience or first call resolution. So every single one of us has called somewhere wanting to speak to somebody, and it took you 2, 3, 4 different touch points to get to that somebody. Well, what is it like when you get to call and speak to whoever you want to speak to get what you need done? I'll use a non-urgent example. And my husband had a birthday last week. We're going to have a family dinner. And the restaurant I called, the girl answered right away. I had nobody else but the girl taking my menu that I could ask all the questions and get all the food ordered for this family party. Seems like not a big deal, but man, I was excited that my need was met in one phone call. I didn't have to wait on hold. I didn't have to get transferred and have somebody hang up or anything like that. So first call resolution, let's apply that to healthcare, because I just applied it to food because it's lunchtime, but we'll talk about healthcare. So when we talk about first call resolution, are you using a setup or technology that allows your patients and caregivers to get the help that they need by the person who can solve their problem as quickly as possible? There is an industry stat that on average, it takes about 32, 33 minutes for a patient or caregiver to get a clinical person on the line. So let's talk through what would take so long. So we're all thinking, hey, you're not going to wait on hold for 32 minutes, right? They're not. They're going to call the answering service. And then the answering service is going to take the message. And then they're going to hang up from each other. And that answering service is going to connect to the caregiver. The caregiver, when they're done with whatever they're doing, is going to then grab that message, go to their system, look up the patient information because they just got a random message and, there could be 5 John Smiths caring for their mothers. They look up the information, get the phone number, call the patient caregiver back, and that's where those minutes start to add up. So how can you do it better? How can you find the ability to get resolution within 1, maybe 2 phone calls by using some technology? And it's a different concept. However, when we talk about it, we're like, yeah, that's what I want. I want first call resolution. So finding the ability to get those patient calls answered by the right person as quickly as possible is huge in identifying ways that you can not only create a better experience for your patient and caregivers, but your staff. Imagine what it'd be like if you just got the call as the nurse. If I'm the nurse and I get the call, it's so much better than getting the message or the voicemail and then calling back to get information and then calling somebody else. Minutes matter to everybody. Right, Bridger, let's go to the next slide. So with that being said, I'm giving you a first case or a first glance at how you can solve a problem with your problems now, right? But everybody has the goal to grow. So what does your strategy look like now that aligns with your growth strategy for the future? Or what you're doing now scalable for where you want to end up? There's this old philosophy of the definition of insanity is doing the same thing over and over and expecting different results. Well, if you're not growing now with the way you're doing, how is doing the same thing over and over really going to impact your growth strategy if you haven't changed a thing? So let's talk about aligning what you're doing now to what you want your future to look like. So I'm going to walk through just a couple scenarios about workflows and doing things a little different than what we are used to doing. And sometimes it just takes talking about it that you can get those wheels turning. So hopefully that's what you can experience today. So Bridger's going to click through a couple different things. I'm going to talk through some different ways of doing things. So the good old-fashioned way of doing on-call, which is when I started out in hospice, Bridger aged me, 20 years ago as a nurse, 21 years ago. When I started out in hospice, what drew me to it is I just had my first child and I saw this ad in a newspaper. Yes, a newspaper. Hey, work from home. Come work for us. So when I called, they're like, yep, we're looking for an on-call nurse. You can work from home. We'll just forward the phones to your cell phone. You just take all the patient calls that came in. I was like, oh, this is awesome. And it was a startup. So I was like, they're paying me for doing nothing. This is fantastic. I'm going to use that as another example of aligning your resources correctly as well. But it was a dream job at that time. So I was like, oh man, there's hardly any patients. I don't get a lot of calls and they're paying me to do this. But that's the good old fashioned way, just forward to a cell phone, and if I happened to miss a call, it went to my personal voicemail. I grabbed it, called the patient back, all of the good stuff. So let's think of doing things a little different way, because guess what happens if I forgot to write something down or if I didn't catch a call? I have no paper trail. There was no recording. There was just me saying, well, she said this and he said that. And there was not a lot of documentation or data. So patient caregiver could call in now. What if you had a solution that allowed that call to route directly to a clinician that could answer their call in less than a minute? And we talk about answering call in less than a minute. And we're talking about hearing that greeting, validating they called the right spot. Hey, a nurse is going to pick up the phone in just a moment. That's the patient caregiver experience. And all while that's happening, you're capturing that call recording. You're getting analytics and reporting and based off of just items that you don't think you need visibility into, but how are you going to do things better if you don't know what's happening? So from there, it also has the ability to interface with your EMR. So I gave you that example of, great, now I got to look up the patient's name because they just spelled it this way. And I think they wrote it phonetically. They didn't ask him how he actually spelled his name. And so I don't have great information to verify unless I have a connection with our interface, with our EMR interface with a software. Because when that interface is happening, it is also routing, recording, and reporting that phone call. That nurse answers the phone. They're trying for that first call resolution with the information they have available. They're doing their best to solve the patient problem, but they do know that if they can't solve it on the phone, they can call those boots on the ground nurses to make that visit. Those boots on the ground nurses are cheering because they're only getting calls for the visits. That's their job. They're not getting interrupted with all of the calls. They can focus on the patient care. They got it in a timely manner, and man, they have a team behind them. So let's go back to that orange and gray again. If you want to staff for the worst case scenario, you're going to spend a lot of money, $48 per call, right? But if we can align our resources where we're saying, here's the team taking care of this patient after hours, and that call is a lot cheaper than $48 an hour. All right, let's jump to a different model because that's not not everybody has the one size fits all. So let's talk about, hey, I've got resources. I have staff. I want to increase that 29% utilization and have my nurses take those calls and make the visits because that is what has worked for us in the past. But maybe what you're missing is some analytics. Well, there's another great opportunity where that same patient or caregiver could call in. That same technology can route it, record it, and report on it directly to that person who can solve the problem, and that can be your staff member. But hey, if that staff member's in a visit, you can also have the solution of a backup plan. Maybe you had a couple people call out sick, and so your triage nurse is slammed. They really need 1.5, and that half person is just not available. It's not cost effective. You got another option where you can have calls go to your team. They can handle them because they do know your patients best. But hey, you have a backup plan. You have a team supporting this patient caregiver. And once again, we're aligning our resources. One more option, we'll jump down to the next option here of how we can maybe do some things a little different and using software technology that can help you do that. We run into multiple partners of ours who have great nurses and they want to keep those nurses and they want to make those patients and caregivers happy. And they really do a great job caring for their patients and caregivers, but they want to have more visibility. They want to have more analytics. They want to have more efficiencies created by software. So what if you just purchase a software that would allow you to do the same great care you're giving to your patients, but create that visibility, the analytics, and that backup plan that you're missing? The efficiencies. I like to think software and automation can create time for us. Who wants more time? I feel like my days are slammed, but man, if I can find ways to automate something, auto bill pay, auto dance tuition, whatever it is, I've created time that I can focus on doing the things that I love to do. So same thing with some software with your team. If you want to take those patient calls, you have a fabulous triage team, excellent. Let's now do the job a little better and create that workflow efficiently and improve technology software that allows those patients and caregivers to give us that 5-star review. So once again, that cloud of magic, CareXM allows that routing, the recording, the reporting of all those patient calls, supporting your team, creating efficiencies because we have an interface, we've got secure messaging for communication. And when that nurse gets a concern from a loved one, they can go back in and say, hey, let's listen to the phone call. This is the advice I gave them. There's no he said, she said, because you've got data. The emotion's taken out of it. You've got data. You can make good business decisions. All right. So let's jump to number 7. Utilizing agile, flexible solutions to staffing. I've only been around for 21 years as a nurse, but buzzword nursing shortage from the get-go. I still remember I was in my, they called it your capstone experience in nursing school. So I am a brand new stinking nurse, haven't even graduated or taken the NCLEX, and I'm doing a phone interview to get my first job. They didn't meet me and they hired me for the ICU. Are they crazy or what? But there was such a shortage back then that they were just looking for staff members to get there knowing they can train them. Well, that is nothing compared to what we're experiencing today. You are losing nurses. We can feel the pain of all of our partners in trying to identify how can I find agile, flexible solutions for staffing, because I want to care for my staff. I want to take care of my patients. I've got a budget, but man, I'm growing too. So how do I do those different things? And the good old days, it was always either outsource everything and lose control or keep everything internally and spend a lot of money. Well, what if we could find a balance? And that's what we hope some of the micro practices that are on this view for you today, doing things that first call resolution, it saves time, real time patient information, patient data, that's your data. It allows you to view it quickly, make business decisions. And when you can create a better patient experience, you're going to have a better review. CAHPS scores are a fantastic benchmark, but we are the world of Yelp and Google reviews. So how quickly can we have a positive halo effect on that patient and caregiver, because they're really remembering their last interaction with you. And that's when that review is going to happen. If it goes bad, everybody's going to hear about it, right? But if it goes really well, they're going to sing your praises that will outnumber any of the bad things that possibly could have happened. So now we're going to really talk about how can I continue to grow and scale without breaking the bank or, losing staff members and turnover that can happen with some of those growing pains. So this is a case study of one of our clients who really took using business analytics to the next level. So this particular view we're looking at is unscheduled interactions. How many of us really know how much distraction or unscheduled things come up in your day? I know there are times I look at my calendar and I'm like 8 to 5, I don't have a wiggle to do anything, but somehow I still get all those red spikes in there. A chat, an email, a phone call, an unscheduled interaction that takes me away from my focus and makes me go a different direction. That happens with our after hours team too, all these unscheduled interactions. But if I knew what they were about, could I plan for them better? Could I prevent them from happening at different times? So when we look at this particular graph, this is call volume. So understanding all the call volume that comes in, broke it down day of the week, time of the day. Do you have that type of visibility into your after hours? All right, Bridger, let's jump to the next one. So this is an example of flexible solutions or utilizing technology as you are growing as well. So the black line, it's kind of the middle line, is the overall growth of their census. So we start in the bottom left-hand corner, about 2,500-ish. And then we end up in the top right-hand corner at I think we're about just over 10,000. And that is a period over about, 48 months, 4 years. So at the same time, the blue line is where they enabled some technology for some first call resolution. So they put the technology in place that allowed their team to take those direct patient calls, handle them appropriately, and be able to give that better patient experience. It's their secret sauce. I just shared the word, so maybe it's not a secret anymore, but it was their secret sauce, using that technology to allow the patient experience to be amazing. And isn't it interesting, as you see the black line going up, you see the blue line crossing down. There's an intersecting point there where they tripled their census, but they decreased their call volume. How does that happen? And this is a period of growth that is exponential growth. How many people really triple their census in 4 years? It doesn't happen often. But at the same time, decreasing call volume and what we would consider a calls per patient metrics. So, they started out about 2.5 calls per patient per week, and they ended up about 1.2 patient calls per week. Same growth pattern happening, but the experience that they had different from others is they use the business intelligence to make better business decisions with the data and change their processes. So their patient experience is a completely different one than maybe others who are growing that rapidly. All right, Bridger, if you want to go to the next one. So this is just a summary, but I feel like it's a cleaner view. So 5-time increase in census while reducing your unscheduled interactions. So growing while improving your processes. Hard to do, but it is possible. So next one, Bridger. So the staffing challenge we talked about. How do you do that while still improving your patient experience? The only answer truly today is technology. If you think of who's caring for those boomers, or I think you called it the silver tsunami as a term we've used before, all of those our parents who are growing older, who's caring for them? We are, our demographics, and we are all guilty of don't leave a voicemail, send me a text. So technology is not scary for us. So utilizing technology with your patients and caregivers to help really care for their loved ones is the new norm. So how can you find technology, automation, software platforms that can help you better patient experience, reduce expenses, improve your reviews, and have better patient outcomes and staff outcomes? All right, I think we're to the point of sharing a video.
But having the nursing background and having a nurse the first time you call answer the phone to help with symptoms immediately has made a significant impact on the care that we're able to provide to our patients and families. And the continuity of communication then back via the report portal, we're able to see what happened all day long. In addition to the layer of support that our call center internally provides, it has significantly improved our communication scores.
Our scores went up 10 percentage points within a year. That's crazy. That doesn't happen.
You can see how many calls we're getting around end of life, the amount of refill requests we're getting after hours, how many patients need help with symptoms, or if there's a DME issue, and being able to have the ability for that transparency to go back and then work directly with the staff and put action plans together that flow up to our quality plan. Like, it's just so the transparency just allows for us to really tackle what our true problems are.
Oop, now it looks like we might have dropped Lori there for a second. And Bridger, I think you might be muted. But we are getting close there to the end. I don't know if you want to jump in here.
Yep, I sure do.
Oh, she's back. Good.
Okay. Can you see my screen too? I want to make sure that that's...
Yeah, still looks great.
Great. Thanks, Hannah. So thank you, Laurie, for all of that. The biggest thing that we're focused on is agility and flexibility. That's what we need in this space, especially in home health and hospice. The organizations that are going to win are going to be agile and flex with their customers, their needs, their patients' needs, their loved ones' needs, and be quick to be attentive, quick to answer, and able to actually scale with growing demand. Being able to flex with your patient demand and accept new patients, grow your census without harming the current patient experience, your patients that you're already serving, and really getting more balance and less burnout. That's our focus. And that's really what, over the next 10 years, 20 years, that's what we all need to strive for. Is how do we create more innovation to be more agile, be more flexible together to serve this growing need base of patients. So with that, we'll take any questions that you may have. I don't know, Hannah, if you want to just, address any or just serve them on up.
Oh, let me get my mute off now. I was going to jump in and just first of all say thank you so much for a really thought-provoking, a really data-rich presentation. fascinating to follow along with the case study. Lots of great helpful information. And we've got just a few minutes to jump in and do some questions. So we'll dive right in. I'm going to first start with a pretty basic one. And we've got a couple that kind of overlap here a little bit. One is just really generally, can you really take all of our calls? And then the other one, you could maybe roll these together, asks about how do you manage that first call contact while still being able to protect staff's time? And is there any kind of voicemail interaction that occurs as part of that?
I'll go ahead and take that one, Bridger. So can we take all your calls? Absolutely. That is what we're in the business of doing, is taking those calls for our partners. And what we love about the flexibility of taking calls or utilizing first call resolution is enabling you to create a solution that fits you best. So if you're looking for first call resolution, technology can do all the things that you're requesting, as far as, okay, I want to peel off some of these non-urgent calls that could go to a non-clinical representative, so that when somebody says, I need to speak to my nurse, and they press a button or stay on the line to speak to the nurse, it's going to that person who can then help resolve that issue. So the technology is key in creating that experience that will route the call to the person who can help solve that problem as quickly as possible. And I forgot the last part of the question, Hannah. I'm like, I got one and two.
Well, it's talking about how do you set up first call resolution while still respecting staff time?
Staff. Okay. Yeah. So that staff boundary, and it's really, when I talk about the non-urgent versus the nurses, it's really peeling off a lot of those calls that those nurses don't need to answer a call when somebody is saying, hey, I need to speak to the bereavement coordinator about the bereavement group on Tuesday. But people are going to call at Friday night at 10 p.m. because that's when they're thinking about it, right? Mm-hmm. But that is definitely something that could be peeled off, message taken when they get in Monday, go ahead and handle it. But your nurse doesn't need to answer that because it's not an urgent matter. So being able to use the technology to route the call in the right direction. And so that as a nurse and as a clinician, I think we can all voice that when the patient call comes in and it's called that I need to handle and it was appropriate, I never complain. You know, I want to help that patient. That's why I got into the business of doing it. So I never complain and I never feel like it's too much. So if you can get those clinicians answering their calls that they should answer, it's usually a win-win for everybody.
Mm-hmm.
And if I can really quick, Hannah, expand that, she answered that a lot more eloquently than I can. But just, you know, the biggest thing is yes, we can take all your calls. We can take them in 2 weeks. We can onboard you very quick and take 100% of your calls. We can be primary, backup, whatever works. But what we're trying to do and build here is really a roadmap to drive down those interactions. There's a cost associated with an opportunity cost, a dollar cost associated with being on the phone for your clinicians. So the focus and the technology really increases bandwidth, increases time. And we can flex with you. We can take a small census of 10 to thousands. You know, it really works on any scale. But the beauty is you don't have to then, when you have a 30% increase in your census, you can handle that. You don't have to spend 3-4 months trying to recruit and retain the nurses that you already have. You can just flex with your patient need.
That's great. Do you ever encounter issues with, or how do you avoid issues emerging around patients not feeling a continuity of care, patients not wanting to interact with you also, they want to talk to their nurse, the person that they already know, right?
Yes. And that is a common problem in all levels of home health, hospice, any patient care. You know, I have a relationship with Hannah. I only want to talk to Hannah. And you just want to say, I understand, Betty, but Hannah does not work 24/7. So somebody else is going to have to help you, right? So we do try and create that continuity of care. You know, through the platform itself, it does create continuity of care when we have access to patient demographics, meds. It's a smooth transition to say, oh, Bridger, I see that you're calling. This is verifying information, as you really create an opening for them to see that you know them already. Even though I'm not the nurse, I know you because I can see your information. We can start to break down that barrier where they really feel like there is good continuity. And even though this isn't my nurse, Hannah, who's the best, Nurse Laurie is going to be okay. She's going to be able to help me with my need today. So we like to try and partner with our clients to really create that continuity with the patient caregiver experience, but also with the staff experience. They're the number one thing you're really trying to protect as well. So being able to really have a smooth partnership from our nurses to the boots on the ground is also essential because we're trying to relieve that burden for them as well. And if we're more of a problem than a solution, there's a different continuity of care issues. So,
yeah. And just to also expand on that a little bit, we mask the calls so it looks, we're just an extension of our partner. That's really what we do. They don't have to repeat their issues because we have everything, whatever they're questioning on or they don't have to explain. The patient doesn't have to explain it again to a different care provider, a different clinician. So we mask the call. It's seamless. And our clinicians they'll answer as a part of our partner's business.
That's great. Is there, a certain size of organization or revenue size that you generally work with, or can you work with any agency, home health or hospice?
Any agency. And when I joked about my first job, my company would have been so much better off if they had this and then instead of paying me full time. So we work with startups all the way to hundreds of locations. And that's the best part about the flexible solutions is there's an option for everybody and it can change as you grow.
Yep.
That's great. Well, I think we are right up against time here. So if neither of you have anything else that you want to add, I will just go ahead and say thank you so much. This was a great presentation. And everybody who was here should get an email to give you access to the recording and the presentation. And we hope to see you all again soon. Thank you so much.
Thanks for joining.
Yes, thank you. Thank you, Hannah.
Thank you all. Bye-bye.
Bye. Take care.